We will go in through the abdomen. We have to move the bowels and other structures out of the way. Once we've isolated the kidneys, we can then isolate the tumor itself and identify the margins of where we're going to be doing our dissection. We will often use an ultrasound for that. That's not pictured in this animation. Once we've identified the margins and isolated that tumor, we clamp the artery and sometimes the vein to the kidney so that we can really limit the blood loss during the dissection. Once we've done that, we will make our incisions around the tumor and remove it. That leaves a defect or a divot, as you can see. That has to be closed, and then we will sew that up. The dexterity of the robot arms allows us to do that sewing and really close that defect well, just as if we were going to make a big incision.